So a lot of the times there's side effects, and with every drug it has disclaimers, and it could be doing this, it could be doing that, it could be doing that. And so, yeah, you're masking the problem, you're not fixing the problem, and I don't really do anything. I don't treat symptoms, I try and fix the problem.
I was diagnosed with H. pylori. What happened was I started out having some blisters and diarrhea. And so it went on for a couple weeks, and then went into a month. And being a mom, I was like, oh, I'll get over it, don't worry about it. Well, I couldn't get over it. So I went to my doctor, and they tried to tell me that I had herpes and other symptoms, and they put me on medication. Nothing helped. I would say that I've probably seen about 45 doctors. Been to the Osborne Scottsdale Clinic in Scottsdale, Arizona. Been to the Mayo Clinic. Been through Yuma Regional Medical Center in Yuma, Arizona. Diagnosed me with Crohn's colitis in 2006. February 2008, the symptoms came back. They started me on Colizol again. Taking 9 pills a day, which equals about 4,800 milligrams of ibuprofen and aspirin a day, and prednisone, 65 milligrams of that a day, and then painkillers, and of course antibiotics. And I think I have an allergic reaction to the Colizol, the sulfates in it. Just sick to my stomach, and the side effects are bleeding, diarrhea, loss of hair, which I have that already, so it really doesn't help. And prednisone makes you swell up, and of course puts you on a roller coaster ride.
I saw a very sick lady. She was very sick. She was gray. She had no color whatsoever. Her circles, she had like 3 circles blending into one huge one. She was suffering from depression, and she didn't even know why she was here. And it was just like she was just hoping she could find something, but she had no clue. Mm-hmm. We started communicating, and then I did a few little tests and things, and her eyes started sparkling all of a sudden, like, oh my God, this is different. This is different, and this is different. But it was really tough, because she was definitely a downhill spiral. If she hadn't hit bottom, it was pretty close, and I could see that in her eyes. They were really small, and she was all puffy and gray.
He put 3 popsicle sticks in the back of my jaw, and when I came in, you could hardly touch my neck, my face, my head. Everything hurt so bad. And when he put those 3 popsicle sticks back there, it made a world of difference. So for the next week until I saw him, I used the 3 popsicle sticks when I started getting headaches, and went and got popsicle sticks when I got back to Yuma, and used them until we came back, and actually until I got the orthotics. Mort at the compound pharmacy set me down. I was picking up progesterone, and he asked me what was wrong with me, why I talked funny. And I didn't understand what he was asking. I said, well, I have blisters, and I have Crohn's. He says, you don't have Crohn's, you have a TMJ problem. And he picked up the phone and called Dr. Feld, and it was 5:30. They were closed. He let me in and did a couple procedures on me, checking my balance, and I don't know exactly what they call it, if I could stand or hold my arms out. And Mort told me that he thought I had a nerve problem right here called the vagus nerve, and he told me that he didn't think I even had Crohn's because his daughter had similar problems. I've been so many places and seen so many mainstream doctors, and they don't believe in anything holistic, and they just give you a pill to cover it up and a pain pill to make the pain go away. So we were driving up the mountain, and I just kept telling him, neither one of us could believe it. And we couldn't believe that he would stay after hours to even speak to us. We went home and actually looked up some stuff about TMJ on the internet, and because I didn't know a whole lot about it, I didn't realize how much everything is connected, and how this nerve can be connected to my stomach and my colon and maybe be the whole problem because everything is out of alignment. I had high hopes, because I felt like he wasn't pulling my leg, and doing the tests that he did with and without the popsicle sticks made a world of difference, because I had no balance. After he did the testing with the popsicle sticks and I actually had some balance and wasn't swaying back and forth and losing myself to the wall, I knew there had to be something with the TMJ.
She has been diagnosed by so many things going on with her that I had a difficult time even. I knew she wasn't, but I just looked at her. She was going to live like this the rest of her life.
Yeah, because I'm not a sick person. Before 2006, never had any medical problems. I hadn't seen a doctor since 1995, except for my yearly exams. Since I seen him, the first time I seen him, I actually weaned myself off of the prednisone and the colazole. I'm just happy that Mort sent me over and I met Dr. Feldman. I think he's a wonderful man. He is like an angel. A very good person, has a good heart, and he's out there to help people.
First of all, Doc, I want to thank you for inviting me out today. Let me see your new office here in beautiful Palm Desert, California. I love to call the desert home, and I know you do too. We have just a minute before we go. Tell me again, symptoms of TMJ, how people could go about finding a qualified someone to treat it, and just anything else basically you think they need to know.
Boy, these questions, you always ask me a bunch of questions.
All at once, huh?
All at one time, and I'm supposed to answer them. First of all, the symptoms, there are many, many symptoms, that's what makes it so difficult. It really does, because people can have headaches, they can have migraines, backache, neck ache, shoulder pains. They can be dizzy, hearing ringing in their ears. These are all symptoms. Fibromyalgia.
You said fibromyalgia.
Fibromyalgia. That's muscle pain all over the body, and when we don't know what to do about it, we call it something. So that's something. Vertigo, dizziness. People get dizzy and they lose their balance. That's another thing that we work on. These are all things that we can help. Not that we have the answers for everything.
Well, you keep saying we, and I want to make sure that everybody fully understands. Just because you graduated from dental school gives you the right to treat TMJ.
Right.
But the amount of, you've done thousands of hours in education on TMJ. How does somebody go about finding somebody that's qualified, other than obviously coming to you? How would they go about finding a local dentist that's actually qualified?
Well, that's another good question. There are societies that work with people and dentists in training them. We have the American Academy of Craniofacial Pain.
Of which you're a diplomat.
I'm a diplomat of that. American Academy of Oral Facial Pain. So there's societies, and what we've developed now, and I'm kind of proud to be part of it, is because we wanted to help people, and we created a network of qualified people that have been trained, that have the x-rays and diagnostic equipment to tell whether the patient can be helped or not. And that's called the itsmn.com.
Okay.
And they can
so they can go online to itsmn.com and find doctors all across the country that are qualified?
Across the country, yes. And hopefully every day we have another one joining us. But it's a way that they can find someone in their local area.
Doc, I want to tell you, I interviewed you a few years ago in studio. I told you I've spent my life in dental offices. I meet all kinds of people. Your patients, if it had been one or two, maybe, but they continually tell the same story about you. So I'm sure from all of them, and from me, because I'll admit you've treated me, and hopefully from all the people in the Coachella Valley, we just want to say thanks for what you do.
Well, thank you for having me.
Yeah. You've been watching Medical News Network. I'm Mike Wittgenstein. For further information on this subject or any other, please visit our website at medicalnewsnetwork.info. Until next time, keep it healthy.